The traditional role of the doctor is to treat, to cure, and to prolong life. But this is not always in the patient's best interest. Too often, people receive treatments that may be unhelpful and unwanted, particularly when they're coming to the end of their lives. Conversations regarding end-of-life care and choices can be confronting for any doctor.
Yeah, difficult, challenging, it can be quite awkward and confronting not only to the patients but also for ourselves and for the family.
You know, everyone tries their best to do these things, but it's often uncomfortable when you talk with patients about what they would and wouldn't want to have when it comes to end-of-life care, and I think it's something that I'd definitely like to learn more about.
I find it much easier to discuss treatment options and provide treatment regimens, but it's a really difficult concept to withhold treatment and to have those discussions with the patients.
Treatment decisions are being made in hospitals all the time. However, if patients are not fully engaged and included in these decisions, they will risk receiving treatments they wouldn't want. Although these conversations may be confronting, they are extremely important.
There is this mysterious veil around the ICU, and patients' family coming and expect we are able to cure them, keep them alive indefinitely, and oftentimes there's a lot of therapy that is futile and we would not offer it to them. So I find that managing the patient's family expectations is actually quite tricky and challenging. Yeah.
I think it's something that is not only hard for junior doctors, but I think it's hard for senior doctors as well. I think it's hard across the board.
Although doctors may feel apprehensive about this type of conversation, it is so important that these discussions are raised sensitively and honestly, so that doctors will be able to understand patients' views and values, hear their stories, and truly know their wishes. The iValidate course has been specifically designed to assist doctors to become comfortable and confident to have these conversations. The course works from a patient-centred model, encouraging doctors to work with them to help navigate treatment pathways together, while acknowledging that each doctor is unique, so will develop their own approach and style. This course offers a structured framework that is based on advice from experienced clinicians, with steps broken into manageable areas, including initiating the conversation, information gathering, shared decision making, and concluding the conversation well.
Everyone has varying levels of comfort with role play, but for the purposes of today, I just want you to think of it as an opportunity to practice and try and just put yourself in the position of having this conversation as a clinician, as you would do on the ward.
Simulated roleplay offers participants the opportunity to rehearse these conversations in a supportive environment where they are given constructive advice and guidance.
So you got to do quite a few summaries. Did they feel okay?
It was really good to practice with simulated patients and just sort of trial different ways of approaching this sort of situation.
If you're able to run through it a few times, you get a feel for how you want to approach these things.
It's quite nice to know that the different people from different areas of the hospital have the same issues, and we've all come together and worked together to find a framework which works for all of us.
What I reckon is going to be helpful for you now is actually getting the rest of the group to wordsmith. So your strengths are that you are a good active listener and rapport is easy for you.
Without a doubt, I started using it pretty much straight away. There was a big difference in my ability to just even approach a conversation with the patient and how to structure it and get a good outcome for both the patient and for the teams involved in care. Patients often feel relieved when you do bring it up and discuss it. And family as well, often I feel uncertain about bringing it up with their loved ones. What I'd like to start with is talking a little bit about you and how you are at home and what are things that are important to you in your life. If you could tell me a little bit about yourself.
Yes, well, I live alone now. Children have grown up. I've always had a very active life.
I've always thought that it was really important to have good skills around communication and talking with families and patients when they're really scared of what's happening to them and what the future might hold. And a lot of them know that they're really unwell and their end's not far away. It's a reality of life. And I think the course has allowed me to specifically hone some skills and learn some skills that help me negotiate some more challenging conversations sometimes, but also be more proactive and reaching out and having those conversations.
Really want to thank you for having this chat with me. I'm feeling comfortable that you're talking to me about this.
How did your structure tool go?
I think it went okay.
How did you go with the rest of the conversation then?
The summarising allowed her to kind of...
I feel a lot more confident and comfortable doing so. I think the iValidate program has provided a good set of tools to be able to use going forward, and it gives me a lot more confidence now.
I feel like I'm more confident and I have a way to approach it, yes, and certainly the simulated learning helped with that.
iValidate course had really given me a good structure on how to approach these issues, and when I do get nervous, I go back to the structure step by step.
Patients have a right to know what's going on and should be supported to make the decision that is right for them. The doctor's role is not only to treat, but also to offer comfort and support in end-of-life care.